CyberGreen has been developing a groundbreaking work on applying the public health approach or public health paradigm to decrease the area for vulnerabilities and weakness within the national and regional networks. CyberGreen is conducting a project with the ERIA to develop cross-comparable statistics in cyber hygiene and cyber ecosystem health across the its member state in Asia, East Asia, ASEAN region. This framework, the Internet Infrastructure Health Metrics Framework, is a set of models and metrics to measure the public health of Internet infrastructure. I will present about our past research and development efforts and would like to discuss how we can build a safer and more resilient Internet for all with the science of cyber public health. Next slide, please. So we're talking about cyber public health. What is public health and what is cyber public health? Public health is a social or global efforts to identify and analyze the health risk factors to the population level in order to increase the society level of health. So it's not a doctor and individual relationship, it's medicine. But on the other hand, the public health is about population level, society level of health, and understand and identify the common risk factors. Similarly, in cyberspace, we believe that adopting 3 public health approaches can improve the risk resiliency of the ecosystem and revolutionize in the cybersecurity practices. Next slide, please. So that was the public health and cyber public health. The foundation of the public health is the data, it's vital data. Surprisingly, in cyber, we currently don't collect on, we don't have a shared metrics and data on massive scale of cyber incident, breaches, and myriad of risks, risk factors within the internet. Because of this, we cannot evaluate the effectiveness of cybersecurity measures, predict future outcomes, and tangle the wider set of reasons behind the risks, how and when attacks occur, and what impact these attacks have. In my previous work before becoming CyberGreen, before I started CyberGreen, I was working at Japanese CERT, Computer Emergency Response Team. And CERT writes advisories and reports, but it was 20 years ago. But that time, we were trained not to use the numbers because it's never the right numbers and then it's misleading and it's just opinions. But at the same times, policymakers and decision makers demands the measurement and numbers. How are we doing compared with other countries? And often I saw using the numbers works powerfully in that conversation. So that's one of the reasons we started CyberGreen Institute. Next slide, please. One of the most important conditions for enabling robust cooperation in cybersecurity, cyberspace, is the availability of the cross-comparable statistics that empower decision makers to set policies based on evidence, establish priorities, and view trends. CyberGreen focus on raising ecosystem resiliency, developing a set of models and cross-comparable metrics to measure the internet ecosystem health. Next slide. So as we all know, internet is vast and complicated and infinitely interconnected. But our view of its extensive set of interrelated and interconnected risks is very narrow and woefully incomplete. We believe addressing our shared risks may be the most efficient path to dramatic improvements in cybersecurity. So with ERIA's support, as a proof of concept of this vision, we developed IHMF, which is Internet Infrastructure Health Metrics Framework, in 2020. This is a set of models and metrics method to measure the internet infrastructure critical components health. So we started scoring the public health level of DNS, routing, and open services. These are the three critical components that we chose to start scoring. And this year, we're going to add email security, certificates, and security protocols and services. And we measure 250 countries and including countries and territories, area domains, and measure how those countries are operating their critical network infrastructure, critical components and protocols safely and healthy way. So that's what we're doing. Our scoring methodology and algorithm technical paper is available, but we are now conducting validation work next couple of months because we started measuring this score last year, November. So with the 5 months score data, we're going to use the methodology and the data and in score are all needs to be validated. So we're under that work process. So after that, we plan to publish the paper. But if you are interested, please let me know, or please reach out to ERIA. We're happy to share that for your review and would love to hear your validation, review and opinions, input, critiques, all for improvement. Next slide, please. A new perspective. So why cyber public health? Why we took public health? Medical professionals in the dawn of 19th century faced outbreaks of infectious diseases, such as cholera and smallpox. Using data-driven solutions, those early pioneers of public health revolutionized treatment and focuses on the mitigation of infectious diseases. They started looking at underlying issues causing the disease and not just treating individuals that were already affected. You might well know Dr. John Snow, the father of the epidemiology. He started a population level of analysis, not just curing the individuals, and identified by doing that population level analysis, he identified the cause of the cholera was the polluted water. So public health, this data-driven approach is very, very powerful that the cybersecurity we do not have. Other much more recent experience we all had, was COVID-19 pandemic. One of the core lessons of the public health model is that we learned that an individual has very little control over the risks we face or they face. Our individual health is interconnected with the shared health of our community. And it's a very similar thing in a cyberspace. We need to adopt a public health approach to cybersecurity by collecting and analyzing data on a massive scale, creating preventative approaches to shared risks, and developing a healthier, more resilient and robust internet ecosystem for our global community. Next slide, please. So this is our approach to establish a science of cyber public health. There's no science at the moment. We are attempt to develop the science of cyber public health in next decade. This is our approach. Science starts with data, so our top priority is gathering a more comprehensive set of data and standardizing it for researchers. We also think that we need institutions at every level of government, international NGOs, academic institutions, and private organizations to support a mature science of cyber public health. Next slide. So this is a change of mindset and perspectives about cybersecurity. Cybersecurity was about, still now, is about protecting you, protecting me, protecting us against the rest of the world. But cyber public health calls for society level, population level of attention. Public health requires public-private partnership. It requires every layers of stakeholders to involve. Our metrics special advisor, Dan Gear, says common good at that level only follows common efforts. And I love this word. It also encourages international collaboration rather than competition and drawing borders between allies and adversaries. Collecting risks only addressed by the collective approaches. Collective risks only addressed by the collective approaches to mitigation. We started telling the stories and called for the collaboration at a variety of forums last decades and started seeing a momentum. A regional organization such as ERIA, APNIC, European Commissions, policymaking and international norm building initiative such as UNGGE, Paris Call, many places are calling robust metrics and evidential data. Next slide, please. So in ASEAN region, this is a statement of the area's President Nakajima at G20. Digitalization in the G20 economies shall promote development for all. So cyberspace and its risk factors are connected across national borders. So in promoting digital transformation in ASEAN, it is very important to simultaneously also promote improvements in the resiliency of the cyber ecosystem at a regional level. CyberGreen is supporting the establishment of the Center for Digital Innovation and Sustainable Economy within ERIA by providing cyber public health statistics, focusing systemic risks measurement and following the concept of the public health. ERIA shared the vision with us about regional collective risk reduction approach. As we have experienced recently with the COVID-19 pandemic, public health approach promote international collaboration and collective approach to the shared collective risks. Cyber public health model also ensure a coordinated efforts throughout the ASEAN region without stimulating geopolitical tensions or competition among the nations. I have served as the chair of the APCERT, Asia Pacific Computer Emergency Response Team, for 4 years. This is, again, about 15 years ago. Based on my experience, I think this philosophy and approach works great in this region. So next slide. Just like life expectancy statistics, CyberGreen's IHMF and the scoring mechanism is useful in understanding the key symptoms of the poor health in networks, the risk indicators that cause poor internet health, and in how countries score relative to others. For ERIA, this framework is being used as a tool to determine the baseline of the internet health and to create benchmarks for countries in region that would benefit from enhancing access to capacity building, as well as the secure and sustainable digital infrastructure development programs. These analyses will facilitate the rapid expansion of capacity, build expertise, and provide data to assess the effectiveness of mitigation approaches. The cyber public health model encourages public-private partnership, collaboration at the regional level, and collective approaches to mitigation. So from the next slide, I am going to speak about what's the sort of the function of the capability that we are developing and we're trying to develop. So first, the data collection and metrics development. It is common when you go to the conference, like RSA conference or regional conference, you are asked about, so is the cybersecurity, the threat is increasing or is this getting safer? We really do not know. But it's common. I'm sorry. So we should contrast this with the public health, where the cause of death are collected and published by credible entities. Many of these statistics are expressed relative to various populations, and these population statistics are called vital statistics. Few vital statistics are available in cybersecurity, unfortunately, but we do not know. So we do not know how many computers are running in the country. We know how many are sold, licensed, or connecting to various services, which are all not the same. Without that, we cannot measure the incidence or prevalence of problems, and this limits our ability to assess if interventions are effective. So we don't have those type of data to do the science. We should start a work in vital statistics for cybersecurity, including measuring populations, defining analogs of morbidity and mortality would be also useful. There are many scientific challenges in internet measurement, taxonomies, and ontology of harm. If you are interested, we started Cyber Vital Data in initial work and published that on the technical paper that's also with the ERIA. So please take a look at that. Next slide. The scoring and analysis platform. The most important thing about collecting those data is we like to open data to researchers in industry, academia, nonprofits, and governments to begin testing theories and knowledge sharing. So as Hachiyama-san mentioned about these centers have this private partnership of the data platform, which you can share data and knowledge. That's the idea. Next slide, function 3. Data-driven policy design, and this is a great place. ERIA's expertise is the policy design and analysis. So policy recommendations based on robust data and statistics are required, not only for cybersecurity policy, but also for sustainable data transformation, digital transformation development, and economic security. ERIA's building capability to translate the data and statistics for policy recommendations for government officials in the region would be a great value. Next slide. So this is a future phase plan, but in order to collect cyber vital data, or in other words, population data, we believe it is necessary to create an institutional and systemic data collection mechanism at every national level. Data is the power and foundation of science, and every country should have the capability to gather cyber vital statistics, just like every country have certs. This may be a great service at ERIA to provide capacity development program to its member states. But this is, again, this function and service is up a future plan and under the discussion and not being determined yet. Next slide, I'm going to skip this slide and go to the timeline. Cybergreen with the ERIA had started this journey. This is the 4th year. We started from 2000. So it's been 4 years. It's the phase to share. So the first phase, if you see this year 1 to 4, we have been doing the foundational research. So this is the time, it's a phase to share our foundational research and invite comments and critiques for improvement from the communities. So we start telling stories and sharing our technical reports and everything to the community. Phase 4 and at the year 5, we are attempting to share the country level scores of this internet public health of the 6 components. And this is going to be our phase 4 work, phase 3 work with the ERIA starting this April. Next slide. So this is my last slide. I would like to say to this room and the people who's online and participating virtually, please join us, the initiative to establish science of cyber public health. There are many collaborations and support we'd like to have from the community, such as reviewing and validate metrics, algorithm, and method, send us comments and critiques for improvement. Again, all of those technical papers we're listing and disclosing from Cybergreen's website and ERIA's website as well. Also, there are a lot of work we need to define and unlock the cyber vital data and risk indicators. So please join us for that. Help design institutional design and mechanism for national and global scale data collection. Help us making the movement from Asean to the global in other regions. So with that, I'd like to say at the last, but very important, I'd like to express my deepest gratitude to ERIA Hachiyama-san and Luron-san for a great help sharing the vision and empowering the development. Without their guidance and research, guidance and funding, we're not here and cannot get closer to changing the game. We are miles to go and lots of work requires, but we're very thrilled. And I would love you to join this initiative and the journey with us. Thank you very much for your time. Thank you.
Thank you very much,